I think our mission, vision, and values have always emphasized the role of the patient and family in our care, but with our latest strat planning, patient-centered care has taken a front seat to how we're driving the organization. And that was manifest when we did our fiscal recovery, about $24 million. We engaged the community and the public in various strategies there. The legacy of that, though, was as we did our strategic planning exercise, far more community engagement in terms of program delivery priorities, and those kinds of things. And as we brought lean and other methods to the organization, we've actually had the courage to embed patients and families in these lean processes. So everything from hand washing and audits to wait times to the ED process, alternative level of care back to the community. More and more patients and families are being involved in that to help the professional staff really appreciate the perspective of the patient. Combined with our patient relations process and our social media, we're trying to be far more transparent and porous to the community as we plan change or consider change, and it's been relatively rewarding. We had 337 people write to us on our website about our strat plan, for example. Oh, I think it's the full range. It's the people who have concerns and are really want to make sure that various perspectives are incorporated in our decision making or our policies. So smoke free or those kinds of things. To how we manage change with our programming, how we better serve the community. Wait times have been high in the agenda. The hospital itself is relatively new, so the public is still getting familiar with a single site. A single culture, a single value system driving their healthcare system in the hospital. So we're working through various, communication venues like that. It takes a lot of effort, and cultural change is measured in years, not days or weeks. So it's that slow, methodical, consistent, repetitive reminders of policies or priorities or patients first or quick mantras, organizations that are perfectly designed for the results they deliver, or that the only constant will be change itself. So we use those kinds of levers to keep engaging the organization, the community. 75 presentations to the community last year, 60 blog installments. Just keep peppering away at those kind of changes. It's been a long haul. It's also about goal alignment. So as the board, the management, and the senior leadership of the medical staff are all pulling together, we're able to provide a consistent message about change management, a high-performance culture. I think people understand that because we came from the cusp, or the fiscal recovery. Literally, we were weeks away from bankruptcy almost. So that kind of galvanized the organization to say, the past wasn't sustainable and change was afoot. I think you have to be prepared to listen. Don't ask the question you're not prepared for the answer for. So with even the notion of patient-centered involving patients in program councils or strategic plan or fiscal recoveries or opening up the governance boardroom to additional community members at large, being more iterative and interactive at your social media, you have to set the organization up as if we ask a question, we have to be prepared for the answer. And that's sometimes a challenge to cultures which like certainty, they don't, or they resist change. So setting them up for that question and the ultimate answer has probably been helpful. We've used that as we have a process of regularly reviewing policies and procedures. So in the last iteration, the patient lens has been a little more forefront in terms of visiting policies or smoking policies or communication strategies or how we manage programs like palliative care. So we've been relatively forthright in making sure that the patient lens perspective has at least looked at or looked through some of these policies and procedures, and I think it's making some change. We are using resident councils or patient advocates to sort of comment on that, so it's a bit of a negotiating process sometimes. And to be honest, every now and then we sit in on patient complaints and hear the CEO hears firsthand what is going on. And in my last hospital, we actually videotaped complaints that we could turn them into instructional productions so that people could see in the patient's own words things that they were experiencing and commenting on. One of my axioms is I think we'd like to see politicians fighting for health care as opposed to over health care. The federal-provincial dichotomy as Canada struggles on the world stage to provide a world-class healthcare system. It takes a lot of people to do that. I think the other is that we are a large industry, $195, $200 billion, and we're very poorly connected. So investments in information technology and all the benefits that can accrue there through connectivity, interoperability, being able to bring the metrics so we can better track our performance. So I guess at the end of the day, we need to shift from this emphasis on bricks and mortar to perhaps computers and applications.